Hello, my name is Gareth from Cardiff Pain and Performance Clinic, and I just wanted to talk to you today about two really common topics that I probably talk about every day with patients in clinic, which are disc bulges and arthritis. So everybody knows the term arthritis, and I think it's really misunderstood. So the term arthritis itself just simply means joint inflammation. And there seems to be a common understanding within society that if you have arthritis, you're going to suffer in pain for the rest of your life, you're not going to be able to do much, and I just need to take some medication and not really move anymore. I'm going to sit in a chair and kind of that's it, which frankly is so far from the truth, it's unbelievable. So arthritis is very common, extremely common. In fact, when we look at studies, for example, of people who have had MRIs done on their knee, over 77% of people have been shown to have degeneration of their knees and potentially no pain at all. And this is the misunderstanding, that just because I have an X-ray or an MRI scan on my back, my knee, wherever it might be, that shows that I have some wear and tear, that has no correlation on the experience of pain. Because you can have the worst scan in the world and have no pain at all. That's not saying that if you do have extreme wear and tear that you're not going to feel pain, then of course that is also an option. But the flip side is also true. And so it's always context dependent, because in each patient, depending on how the nervous system perceives the situation, you may feel no pain at all. So what can you do to look after your joints even if they have become arthritic? Well, it's the inflammation that often causes the pain. And so diet becomes a huge factor in helping and reducing the pain relating to your arthritis. More importantly is movement and loading, the thing that people are often so scared to do. An analogy that describes how the joints work are often like a giant sponge. And so the health of the joint relies on water being moved in and out of the joint to allow it to remove waste products. And so the more you load that joint, the more you can squeeze that sponge and release those waste products outside of the joint. Now, of course, too little movement or too much movement is no good. And so finding the right amount of loading for you and progressively increasing that over time is the key to getting better. So don't be afraid to do more. When it comes to disc bulges, we often hear people having seen a disc bulge on MRI and then presume that surgery is the next step. Well, I can assure you that that's a very rare thing. And in fact, even people in their 30s, it's been shown that over 50% of those people have disc bulges in their back and are completely unaware. So if you have any questions about your own ongoing arthritis or disc bulge problems, just pop a comment below and we'll be happy to answer.